So these directional terms I'll mention. Superficial opposite is deep, superior, inferior, anterior, posterior, ventral, dorsal, medial, lateral, proximal, and distal. So superficial and deep, as the name suggests, superficial is superficial part of the body, deeper is a deeper part of the body, as a general understanding. Superior and inferior. Superior is above, inferior is below. It is respectively towards the point of anatomical structure you are focusing. For example, the shoulder, if I draw body, just imagine this is a body, shoulder, elbow. So the shoulder is superior to the elbow. And when I compare the wrist with fingers, if I compare this, or you can also use the same superior, inferior part of the shoulder and elbow description. Elbow is inferior to the shoulder. If I compare wrist and fingers, fingers are inferior to the wrist. Wrist is superior to the fingers. Elbow is superior to the wrist. Wrist is inferior to the elbow. So similar description. Anterior means towards the front of the body. So this front of the body description you can call it as anterior. Posterior means which is towards the back of the body, can be called as posterior. Ventral is sometimes used to describe the anterior portion. Dorsal is sometimes used to describe the posterior part of the body. If I draw this body, a midline which divides the body into two halves, the structure, an imaginary structure dividing the body into two halves, I can call it as median, midline, center of gravity, whatever you can call. Anything which is towards the midline can be called as medial. Anything away from the midline can be called as lateral. So proximal and distal are other two terms. Proximal means closest, distal means farthest. So respectively you can describe proximal, distal, medial, lateral, ventral, dorsal, anterior, posterior, superior, inferior, superficial, and the deep. These are directional terms used to describe the anatomical structures.